It's Marissa. I just wanted to make this video. Last time I made a video was a couple days ago, and I said that I still have my teeth. I do. Basically just reiterating, I can't do IV sedation. I want general anesthesia all the way out, preferably with a breathing tube, things like that. I had found one that my insurance was approving, even though it was out of network. I would still have to pay out of pocket and then get reimbursed. I got an appointment with that one, but it's not until September 9th. And the prices are insane. I can talk about the prices, but I'm not going to at the moment. And then I came across another one. So there's two in the city that's close to my hometown. It's closer than the last office that I went to that I was going to get the surgery done at on May 13th. So I think that'll be helpful for my agoraphobia. Anyway, I found that second one. I did try to get an appointment with that office before, and I did, but I had to cancel that appointment, and then I just ended up going to the one about 50 minutes away instead of the one closer, which I should have in the long run. This one has an operating room inside the office, which good, and they do offer the general anesthesia. I've been reading on their website and it's awesome. I had to pay $100 to reserve the appointment. The appointment is May 21st at 10:45 a.m. It's just a consultation. It's gonna be my third consultation appointment. So I'm really hoping third time's the charm with this. And then I think it's just gonna be about $78 for the exam and the consultation, which is a lot cheaper than the first one that my insurance approved me for out of network. Right now it's May 15th. And I did have the other dental office send over a referral to this one that I got the appointment for. This one's also way sooner than September 9th, which I don't want to wait that long anyway. I would rather get this done before my birthday if possible, because I truly don't want to be down and out on my birthday. So I will be back, and this is just a random update. It doesn't have to do with my teeth, but it has to do with my health. I got a CT scan done yesterday for my abdomen. I'll go into detail, but it was just a CT scan, no contrast or anything. Apparently my right lower lung, the right lower lobe, is partially collapsed. And so I am trying not to freak out about that, but that's not a good thing. I did have right lower lobe pneumonia back in January, so I don't know if those two are related, because it's the same right lower lobe. So I'm honestly horrified at kind of contemplating going to the ER. Not sure though. Hi, it's me again. So today is May 20th. Well, it's technically May 21st now, but yesterday I had to go to the doctor because I don't know if I mentioned it. I did mention that I had a CT scan and my lung was partially collapsed, like my right lower lobe was partially collapsed. And so for about a week now, I've been having upper back, neck, and shoulder pain. And I thought that that had something to do with my lungs, so I went to the doctor yesterday, and she said that it's not, because it was so minimal, and it's probably likely my muscles, because I have horrible posture and I tense up a lot. She had me do tests, so when I turned my head, it was really hurting. It's like really tight in my shoulders, and then when I did it up and down, it bothers me in my neck. So she referred me to physical therapy, and then I also have to get an x-ray. At this point, I love radiation. Just one after the other, give it to me. So I have to get an x-ray of my cervical spine just to make sure, even though it's most likely my muscles, tension. It's pretty painful, I will say, but I'm hoping that physical therapy works out. I have spoken to the new dental office a few different times, just to confirm things before my appointment. So they got the referral and the x-ray, so I don't have to get new x-rays. They don't cover my insurance, so basically I'll be paying out of pocket for the consultation, which I think she said would be like $78, which is pretty good, I guess. I mean, I don't really want to pay anything, but I have to if I want to get the general anesthesia. So it's technically today. I have to be there by 10:45, but they texted me and said to be 10 minutes early. This place is probably about 45 minutes away, which is only 5 minutes shorter than the last dental office I had gone to. So but I mean, I gotta do what I gotta do. I also submitted a claim to my insurance to see if they can approve me for out of network, meaning I would have to pay out of pocket and then they would reimburse me. So I'm hoping that that gets approved. Now, they did inform me that the dentist won't be taking out my wisdom teeth because the right one is horizontally impacted. It's basically right in my sinus cavity, and he wants to refer me to an oral surgeon, and I said that's fine, because maybe then, you know, if he's not going to take either of my wisdom teeth, it would just be 2 teeth and I can go through with the IV sedation. But he said that he would be fine pulling the rest of them. So I guess tomorrow I will find out, because he looked at my x-rays, if I didn't mention that, because she called me, the office assistant, whatever. She called me and said that the doctor looked at your x-rays and had to let you know, didn't want to waste your time, but you wouldn't be doing the wisdom teeth. And at first I thought she was talking about all of my teeth, so I'm like, so he wants me to go to an oral surgeon for all of my teeth or just the wisdom teeth? And then she went ahead and talked to him again, and he said just the wisdom teeth and he'd be fine pulling the rest of them, which, if I'm correct, they wanted to do originally 31 extractions, which would include the wisdom teeth, but without those I think it would still be 29, which is very high to me. So tomorrow is my consultation. I hope that it goes well, because like I said, I have to pay for this out of pocket, and I will inform you that I don't have a job. I am classified as disabled by the government because of my agoraphobia and all of my issues. So hopefully something can be worked out, and then hopefully get reimbursed by my insurance. But yeah, just an update on my teeth. They're still looking the same. This front tooth with my original abscess that I got back in December, it's been really sensitive lately. Like, I don't know how to describe it. It's just sensitive. The other abscess, I have been getting some pain in it off and on. I mean, it's not constant so far, but I'm just hoping tomorrow, everything will work out and I can get the surgery scheduled, because that's what my main goal here. I want my teeth out still. I am also considering snap-on or snap-in dentures, where you get like 2 to 4 implants and then they just snap right on. I like that better, because then they won't move around and I won't have to use adhesive, and you can still clean them. So like if you get the all-on-4, those are permanent. You cannot take those out. But with snap-ons, you can take those out yourself, and it's dentures still, but they're just supported by implants, which I like that a lot, and it's a lot more cheaper. I'm thinking about talking to him about that tomorrow, just to see what my options are, if I even qualify, because I do have periodontal disease and I do have bone loss. I don't know, because I was watching some videos on YouTube of this woman who got a full set of dentures, like top and bottom, at 20 years old, and she wore them for 11 years, and she had severe bone loss, and I don't want that to happen to me, honestly. So that's why I'm truly considering the implants, because the bone loss scares me. She said that her gums were paper thin, her jawbone was like non-existent, and she was getting to the point where she was losing so much bone that she almost couldn't have the implants, and she finally got the implants, and now she's not having bone loss, which is great. Yeah, that's the problem. When you get your teeth extracted, you will lose the bone because there's nothing there anymore to support them. So I guess I'll be talking about that. I'm not saying that I'm going to get them anytime soon. I just want to see what my options are, to see if I even qualify, what the price would be, if I should get them just on the bottom or if I should get them on top and bottom. I probably would just do the top and bottom, because if you want me to be honest, I don't like the palette thing on the that covers the roof of my mouth with my dentures. I have a feeling I won't like that even when it's in my mouth, and I don't like it right now even though it's not even in my mouth at all. I will talk more about this tomorrow. I will see you again. Good morning. It's consultation day. I haven't gotten ready yet, but I am nervous. It's rainy, so we'll see how it goes. So basically, I completely forgot to make any type of video. Because I got ready and then I forgot to brush my teeth. So yes, I realize they're bad, but if I go to the dentist, I like to at least brush them. And I didn't, so yikes. I have to go get x-rays done on my cervical spine right now, but once I come back from that, I will let you know what's going on. Okay, I'm back. It has been a very long day. I got the consultation appointment. I did my cervical spine x-rays. My back is killing me, but I wanted to go through everything. I wish that I would have made videos while I was there, but I didn't. I just wasn't thinking. Of course, I am still going to be getting a full mouth extraction. My teeth are not restorable. I figured as much since 2 other dentists said the same thing. They're not taking my wisdom teeth, which is, it's okay. They're not bothering me at the moment. I can just do those at a later date, and maybe it'll be fine for the IV sedation because it's just 2 teeth then. They're gonna be doing 28 extractions with these, and a lot of them are surgical extractions because obviously he looked in my mouth and he was just naming off if they were gonna be surgical or simple. I will put my treatment plan paper in here. That is that. The total price was $6,803 because I had put down a $100 deposit, and that went towards the price of the consultation today, and then I had about 21 left over to go towards the price because it was $6,824 and then it went down to $6,803. It's been paid, but I have to make sure I get the reimbursement from my insurance so I can pay that back. It was a lot cheaper than I thought it was going to be. We'll talk about prices in a different video, but it is general anesthesia, which I'm stoked about. I flat out asked him, am I going to be completely unconscious? He said yes. So he was really nice, really awesome. He said eventually I could try to get implants in the bottom and do like the snap-on dentures, which is something that I've been looking into anyway. So maybe when I get my wisdom teeth extractions or something, I can try and talk to whoever is going to be doing my wisdom teeth and go from there. Surgery day is for June 23rd. That was a fly. That was so random, I'm sorry. June 23rd at 8 a.m. I can't eat or drink anything after 11 p.m. this time. I'm not allowed to take my medicine in the morning. They won't place my dentures for me, so I'm going to have to see if I can get an appointment for the same day with the OG office that I first saw so they can put them in, because I truly don't want to be toothless. I'll show you my paperwork here. Kind of the same instructions as the IV sedation, but they're still going to use an IV, but it's not IV sedation. It's really like general anesthesia. But yeah. I'll be back on antibiotics for a little while, which is okay. I'm sorry if I seem out of it. It was just a lot today, and I'm tired, but I'm happy that it's going to be the general anesthesia, which is what I've wanted all along. Just to figure out how to get my dentures placed. I guess figure out the wisdom teeth as well. He said that I don't really have a lot of bone loss. I'm only 24, so I'm just so tired. I want to get this video up. I will start the antibiotics tomorrow because I have to take 2, and then we're going to be 4 times a day, which is so fun. But it's amoxicillin, and I haven't taken straight amoxicillin for a while. It's usually amoxicillin clav, but I don't mind like the amoxicillin anyway. And it's a little bit different than the clav because that's augmentin, whatever. Nobody needs a lesson about antibiotics. They were all super nice at the office, understanding, and I'm honestly, I know that I don't look it, but I'm very excited. Obviously scared, but I'm excited for the fact that I'm gonna be asleep like I wanted. Yeah, they're gonna come out and it's gonna be okay. It's after my birthday, which sucks. I really wanted to have a nice smile on my birthday, but it's okay. Now I'm just waiting for my x-ray results to see if there's something wrong with my spine or if it really is my muscles, and then physical therapy. Gotta figure that out. I got put on a cancellation list. I'm just so tired. Yeah.